Hi, my name is Haley, and I'm going to be demonstrating how to insert an indwelling catheter on a female patient. The first thing I'm going to do is check my patient's chart for any physical limitations and the order to insert the indwelling catheter. Next, I'm going to gather my supplies and get assistance if needed, but I will not need any today. Then I'm going to perform hand hygiene and apply any PPE if necessary. The next thing I'm going to do is identify my patient. Hi, Mrs. Jones, can I please check your wristband? Can you state your full name and date of birth for me? All right, thank you. All right, and then next, I will explain the procedure to my patient and see if they are able to assist in any way possible. Then I'm going to ask my patient if they have any allergies, specifically to latex or iodine. Ms. Jones, do you have any allergies today, especially to latex and iodine? No? Okay. And then I'm going to make sure that I have good lighting in my workspace and that there is a trash receptacle nearby. All right, and then I'm going to gather my supplies on an overhead table. And then I'm going to make sure that my bed is at a good working height. So I'm going to raise it to about elbow height, but today I'm going to go about to my waist. All right, and then next I will put my patient in a dorsal recumbent position with the knees somewhat flexed and abducted, feet about 2 feet apart. Okay, and then I will drape my patient with a bath blanket. Only exposing the area that I will be working with today. Okay. And then next I'm going to put a waterproof pad underneath my patient. Okay. And then I'm going to put on clean gloves and wash the perineal area of my patient. I'll be using warm water, soap, and a washcloth. Okay, and then I'm going to make sure that I use a different part of the washcloth for each stroke. I'm going to move from one labia fold from the top straight down. Use a different part of the washcloth. Do the other side, and then from the meatus down to the anal area. And then I would wash and dry my patient and remove my gloves and perform hand hygiene. And then at this time, if there was another drainage system that we would be using, I would set this up at this time. Okay, and then next I'm going to set up my sterile catheterization kit using sterile procedure. Okay, and then I'm going to put on sterile gloves. right, and now I'm going to put my drape underneath my patient. Okay, and then I'm going to put my second one to extend my sterile film. All right, and then at this time I will demonstrate how to put on a fenestrated drape, but I will not be using it during this time for the procedure. I would just apply it here on my patient and just make sure that my working area is the only thing exposed. Next, I'm going to put my tray in between my patient's thighs. And I'm also going to be gathering the catheter and also opening my specimen. All right, and then at this time, I would start opening up everything. I'm going to remove the cap from my syringe and insert it into the balloon port. Okay, and then I will open up my antiseptic solution. At this time, which for the sake of this video, I'm not going to be doing that. I would fluff my cotton balls and pour it over there, and then I would open my lubricant, pour that into my tray as well. Okay, and then at this time, I would also check my drainage bag just to make sure that the clamp is locked. All right, and then I'm going to lubricate the first 1 to 2 inches of my catheter. All right. Okay, and then next I'm going to, with my non-dominant hand, I'm going to hold open the labial folds and expose the meatus. And then with my dominant hand, I'm going to take my forceps with my cotton balls, and I'm going to start cleaning the area. I'm going to do 1 labial fold down, dispose, the other side, and then straight down from the meatus down to the anal area. And I'm going to keep my hand in place here until the end of the procedure. The next thing I'm going to do is take my catheter, and then upon insertion, I'm going to just tell my patient to breathe deeply, and I will insert it until I see a little output of urine, and then once I see that, I will advance it about 2 to 3 more inches. So start inserting my catheter. Okay, I see a little flow of urine, so I'm going to advance it about 2 to 3 more inches. Okay, and then with my non-dominant hand, I'm going to hold that in place at the meatus. With my dominant hand, I'm going to inflate the balloon. Detach my syringe, then I will give it a little tug, making sure that there's some resistance, which is there. Okay, and then at this time I would clean up my patient if necessary, and then I will start discarding my supplies. Per facility policy, and my syringe would go into a sharps container. Okay, and then I would remove my gloves. And then I would attach the catheter tubing to my patient's thigh using a leg strap. I would make sure that there was some lenience in the tubing so that they have range of motion. Then I would get my patient to a comfortable position. Then I would cover them with their bed linens. And then I would lower the bed to the lowest position. And then I would attach the drainage bag to the side of the bed, making sure that it's below bladder level and that there's no kinking in the tubing and that the movement of the side rail will not interfere at all. And at this time, if I need a urine specimen, I would put on clean gloves and take the urine specimen directly from the drainage bag. I would then label it and then send it off to the lab immediately or refrigerate it. And then I would remove my gloves and my PPE and perform hand hygiene.